Good evening, everybody. Welcome to CIVIC, and welcome to our first virtual webinar version of CIVIC. We certainly would have loved to have gathered with everyone here that's joining us tonight, but in light of the pandemic, we need to use this format. It was great to see everyone in our rooms earlier, and thank you for joining us early. I have a few thank yous before we get started. Of course, thank you to our sponsors for this program. The Lyndhurst Foundation and the Riverview Foundation have been longtime supporters of CIVIC, and we really appreciate their support. I want to mention that if you have questions tonight, look in the lower part of your screen and put those questions in the Q&A box, and we'll get to those at the end of the program. It's a great pleasure tonight to have one of my dear friends and one of my mentors in my career, Ann Coulter, with us. And she's just a fantastic facilitator. She's a fantastic strategic thinker, excuse me. And without further ado, I want to introduce you to Ann.
Thanks, Eric. Hello, everybody. It feels weird not to get hellos back, but I hope you're doing them where I can't hear them. There we go. Thanks, Eric, for pressing ahead with CIVIC, a digital CIVIC. I hope the next one we'll be able to see one another in person. So that's definitely what I'm looking forward to. I want to thank also Lindsay and Beverly for figuring out all the technology. It looks like it's working, including the pre-session where we got to see some nice summer drinks being made. And to Tina Vance, and as always to Rob Taylor for the inspiration he provided that started this series. When Eric called me and asked me about facilitating this session, and he said it's going to be about creativity and resilience during COVID-19, and I was thinking, how can I get out of this? How can I say no nicely? And then he told me who the panelists were going to be, and I thought, well, they can pull this one off. I don't have to. So I agreed, and I'm glad I did. And the conversations that I've had with the panelists prior to this tonight have been really good, and I know you're going to enjoy hearing from all of them. And when we think about the topic, two really important words: creativity and resilience. And to me, creativity is problem solving. They're pretty much synonymous. And we've got some great problem solvers on our panel tonight. And then when you think about resilience, I went back to the dictionary and looked to see what dictionaries had to say about the meaning of that word. And there are two related notions that are mentioned. And one we're going to focus on more than the other. The first notion about resilience is that it's the capacity to recover from difficulties. I think we can all kind of identify that with regard to this topic tonight. And then the second notion is the ability to spring back into shape, or elasticity. So think about something sort of popping back into the shape or the form it was in before. And it's that meaning that I think the panelists want to bring into their comments tonight, because it came out in our earlier discussions. And that's because the shape we were in prior to COVID-19 was not a really very good shape. Not necessarily the shape of a thriving and healthy country. And the impact of the pandemic has brought that fact really starkly into relief. For example, when we have illness and death that's disproportionately suffered by people of color, and as we know in our own community by the Hispanic populations, and when the majority of essential workers are women, many of whom are among our lowest paid workers, often without health insurance, when small and minority-owned businesses have a hard time competing for the federal funds that are available for other businesses, then our problems are bigger than a virus, and those problems are going to remain with us. So The work of our panelists couldn't be closer to this real reality. And they know that springing back into shape, that second meaning of resiliency, is really not the answer. So they're going to talk about what today's reality is like for their work and what they're hoping and planning to do after the immediate crisis is over. So we've got two parts to our program. We've got four panelists. The first question that they will each address in about 5 minutes, 5 minutes each, that is their work and how COVID-19 is impacting the communities that they work with and in. And then we'll switch to the second question, and that is how this experience during this time of the pandemic is changing their work and what thoughts it's giving them about how they'd like to work in the future. I'll do a very brief introduction. We're going to go in this order with the first question. Dr. Michelle Pickett, then Michael Stone, then Jermaine Freeman, then Greg Heath. For the second question, it'll be more of a free-for-all. And then we will finish up as best we can, 15 minutes before the end of the program, to try to get to some of the questions that you've asked in the Q&A function. And Eric and Beverly will help throw those questions to the right person. Dr. Michelle Pickett is the founding physician and executive director of LifeSpring Community Health in Chattanooga. And that's a faith-based community clinic that uses body, mind, and soul approach to wellness, serves primarily uninsured children and families in our community. Many of them are undocumented residents. It's one of the most inspiring community stories that most of us have maybe not heard of before tonight. She is also a part-time assistant professor at the UT College of Medicine in Chattanooga as an assistant professor of pediatrics. She is on the forefront of creating a new urban pediatric practice model. Michael Stone is the director of innovation learning for Public Education Foundation here in our city. He's a former classroom teacher of chemistry, physics, calculus, and computer science. He served as the director of the fabrication lab at our local STEM school, and then he did a year in Washington, D.C. as an Albert Einstein Distinguished Education Fellow at the National Science Foundation. Back in Chattanooga, he led the creation of a network of local public school VWE labs, a model for the country. And I'm sure he's going to tell you a little bit today about when thousands of school children were sent home a couple of months ago, he and 63 other local teachers created a 3D farm, and have already printed over 7,000 face masks for local frontline healthcare workers. Jermaine Freeman is a local graduate of CSAS, an honors graduate of Morehouse College in Atlanta, and an MBA graduate from UTC. He is also a former classroom teacher in Chattanooga and a successful entrepreneur. He was a community organizer in college and worked for Obama's re-election campaign in Florida. He was the first engagement director for Unify Ed back in Chattanooga, where he stayed, thank goodness. He's a City of Chattanooga's civic engagement coordinator in 2016, 2017 director of economic programs for the city, and was most recently named the city's deputy chief of staff in City Hall, where he's a key member of the administration's COVID-19 response. Greg Heath is a Gary Professor of Public Health Programs at UTC. He also is an adjunct professor of medicine at the UT College of Medicine in Chattanooga. He spent over 20 years at the CDC, starting as an epidemic intelligence service officer, which is the start of over continuing career devoted to epidemiology, prevention and management of chronic diseases, and he is also heavily engaged in our local efforts to understand and combat COVID-19. So with that, I will put myself back on mute and turn to Michelle to talk about her work and how COVID-19 is impacting the communities that she works with. Michelle?
Hi, everyone. Thank you so much for inviting me to be a part of this panel. We certainly are trying to be creative. I think of us as problem solvers. I think the problem is way bigger than we are, but we definitely want to be a part of the solution that we to the problems we see. Okay, I'm going to try to share my screen with you all, so bear with me. I'm a pediatrician. I've been in Chattanooga for over almost 25 years now, and I started out my life in a small island in the Bahamas, and immigrated to New York City when I was 15. And immigrated to Chattanooga, Tennessee when I was, 25 years ago. Let's just leave it at that. The mission that you see before you right now really is a mission that has grown over all of those years. It is a mission to demonstrate the love of Christ by providing this clinic with exemplary medical staff and innovative services. And we want to embrace the whole child, the whole family, and our goal is really to transform our community. And we at LifeSpring started out taking care of immigrant children back in the mid 2000s. They were coming to school, and teachers were very concerned that they had nowhere to go. For healthcare, they were not going anywhere for fear or various reasons. And it is in that time that we began as a ministry out of New City Fellowship, and we served purely undocumented children, and we did it in the basement of the St. Andrews Center. Over the years, we began to reach out to the community and really wanted to take care of all children if they wanted to, and wanted to provide that kind of quality care for any kid that wanted to come to see us. And so in 2010, when Dr. Minnie Vance retired, she found out what we were doing, and she let us use her building. So we transitioned out of the St. Andrews Center to the Macaulay office, and in that transition, we decided that we wanted to also take care of kids who were on Medicaid or TennCare, as well as to continue to take care of kids who are uninsured. Presently, our children are a variety of, let's see if I can go the right way. I was going to give you a sense of our children. In 2019, we had over 5,000 encounters with children. We created a practice that is a full pediatric practice, but we also included something that is a little different, and that is our community health workers to address the social determinants of health that we find that so many of our kids, so almost 80% of our kids are either on TennCare or uninsured, over 80%. And so those kids have needs. They have food insecurities and educational insecurities, work and employment and housing, and all of those things impact the health of a child. And so we do not see how we can take care of children medically without addressing those. And so we have hired 2 community health workers who work arm in arm with our nurses and our nurse practitioners and our pediatricians to help address those needs of our children. We are diverse demographically, both culturally and racially. 39% of our kids are Hispanic or Latino, 24% African American, and 18% are white, or and then other people. The other is not an other race necessarily, they just didn't declare a lot of the times. How has COVID-19 affected our population? The poor social determinants of health that I just mentioned in our families, this pandemic has just aggravated, exacerbated, deepened, widened, whatever word you want to use. It has certainly come to bear on their families. We do surveys in our kids and when they come for well visits, and we have had to change a lot of the ways we have practiced, which I can get into later. But some of the things that we have learned from our families is that they have lost work, they have lost income, they have lost the inability to feed their children appropriately. Their housing is crowded, and so it makes them more susceptible to transmission. And in a world where we are enjoying this technological advancement, they are not quite there yet. And so educationally, some of our kids are falling behind because if they were able to pick up an iPad, they either had no Wi-Fi or did not have the know-how to understand how to link to that. So we have partnered with the schools and calling all our patients to try to keep them connected. And that includes being able to connect to healthcare. So that's a mouthful, but I think that's enough for now.
Thanks, Michelle. Mike, let's hear from you.
There we go. Well, thank you, Anne, for the flattering introduction. I'm definitely honored to be on this panel with such esteemed colleagues, for sure. So I come at this from the angle of education, and specifically K-12 education. That's certainly my background. And when Eric and Beverly had approached me about speaking and sharing our story, I found myself a little bit taken aback, just kind of wondering what we really had to offer as I realized the magnitude of what's going on in the healthcare system. But the work that happened, that has happened in our public schools with teacher-led innovation, with administrator-led innovation, has really been impactful. So I prepared a couple of slides to share with you, and if you'll bear with me, I'll try to pull that up here quickly. I think that's sharing. So Anne mentioned, as I joined the Public Ed Foundation about 3 years ago, Volkswagen North America and the state of Tennessee made a significant investment to bring Volkswagen e-labs to schools. They're state-of-the-art, they're called digital fabrication labs. They bring all kinds of advanced technologies, 3D printing, laser cutting, CNC routing to schools. We had a press conference in September of 2019 where folks from MIT came down and declared that we now have Hamilton County Schools is home to the largest fab lab network anywhere in the world, meaning that something on the order of 14,000 public school students, 6th through 12th grade, as of this school year, have access to these advanced technologies that are really only ordinarily found at elite universities and in community centers. Well, to get to what happened with COVID, the quick version is we started making face shields, and in the introduction, Anne kind of stole a little bit of the thunder, but I'll just show you here. You can see in the two pictures on the slide. So the face shields are not the N95 mask, but the plastic shielding that they're wearing in front of them. And really what happened on this, there's a little bit of a story behind this and then a bit of a pivot, is as we were closing schools, as we realized the pandemic was here and we had to make accommodations for obvious reasons, we sent students home, and I got a call on a Thursday night from Jill Levine. She said, "Hey, I just realized we've got like 100 3D printers sitting in all these labs. Is there any way we could help with the PPE shortage?" I said, "I don't know anything about PPE. I'm not trained in medicine. I have a little bit of experience with 3D printers, but it sure seems like we could figure out something." Well, About a week later, put together a little timeline for you. About a week later, we had stumbled into a design that we actually found from a guy named Joseph Prusa, who's a 3D printer expert in Czechoslovakia. He had designed a shareable, scalable, open source design for 3D printing, essentially the headband for these face shields. So March 25th, we gathered 63 printers from, I think it was 19 Hamilton County schools. Some of them with E-Labs, others just happened to have 3D printers they were using like in STEM labs or maker spaces. 2 days later, we were ramped up to full production. And I don't want to gloss over an important point here. There's not enough space to put logos for every company and organization and individual that contributed to this effort. But there was a fair amount of press that covered what was happening, especially as we were ramping up. But what really took me, not by surprise, but just really was captivating, was that we really got to live out what it meant to be a part of the Chattanooga way. As word spread that we were printing these and we had access to all these printers, ordinarily 3D printing PPE or 3D printing anything at scale is not a realistic option. 3D printing is kind of slow, but because we had so many printers available, we were able to mitigate some of the speed issues. But that still meant we had to source material, and I don't work in logistics and manufacturing, and none of my educator colleagues have any experience in that either. We worked with Andrew Rogers, with the Enterprise Center, with the Chattanooga Chamber, and what originated on the 25th or 26th as a phone call to a couple of people I thought might know something about manufacturing and sourcing material in bulk. By the 28th, not captured in this slide, but by March 28th, we had a phone call with over 25 leaders from our community. I mean, these were from CEOs to VPs of logistics, to purchasing personnel from large companies to small companies, all at the table in a Zoom call, trying to figure out how to get material and work on this. As you can see, by April 28th, we were able to manufacture, assemble, and deliver right at 7,200 face shields. I keep joking, we must have broken one or something. I don't know how we ended up with 7,199. But we were able to distribute those to healthcare providers in our region. And really for teachers, and this is really what, as I think about, and as I was asked to sort of think about what does it mean to be a creative problem solver, and really what does resilience look like in a time of disruption, in this case brought on by this unexpected pandemic. All I can think of is the mantra that we're starting to see emerge in our schools that I don't know has really spread outside of our school buildings. I don't know that everyone in our community understands that this is happening, but for teachers to come together, I think missing on this slide also, but so we had a little over 40 teachers contribute over 1,000 hours of volunteer hours to run this farm, to assemble these pieces, to troubleshoot the 3D printers. We worked with UTC students to do that as well, namely Chance Yanagita, for those of you who know him. He spent an inordinate amount of time on the farm keeping us up and running. But as we did that, what became really clear was something that we talked about. There's a picture of the bigger farm. Something we talk about all the time in these labs, and it's this idea that what we're trying to bring to students is yes, we want to make sure that every student in Hamilton County and perhaps even across the state or across the country has access to these kind of learning opportunities where they get hands-on experiences with advanced technology like 3D printing. They've got to get a tangible, meaningful experience with what the future looks like. But I think far more importantly, as a dad of 4 daughters, and as a career educator, what I know is that we get asked all the time, how do you prepare kids for jobs that you don't even know will exist, right? Like we have no idea what's going to be going on. I know 10 years ago, running a 3D printer farm with public school teachers to make PPE for medical personnel was just, I mean, that wasn't a thing. It wasn't a thing we thought about. So 10 years from now, when we think about this, how are we preparing students? Well, rather than trying to be Nostradamus and predict what skills they're going to need in terms of technical fluency, or even what content they have to master, increasingly what we talk about with students, and the teachers embraced and modeled this, is this idea of being a master learner. In the business world, we talk about a lot this idea of agile problem solving, that I don't have to know everything, but I have to be capable of learning anything quickly. It's a through line really for what is transforming at the very foundation of what it means to be an effective educator and a successful student. And for us, what COVID-19 has brought, we're really excited, and there's been, as we look to the future, some real interesting movement about how do we leverage the disruption brought on by the pandemic to catalyze systems level change so that we really do have an opportunity to level the playing field when we think about diversity, equity, inclusion. It's not just about making sure that every student has access to a computer or a 3D printer. It's really making sure every student has access to all of the things, right? It's access to tangible items, but it's also things like social capital. It's things like collegiate experiences and being able to see beyond their bubble. That's something that usurps a neighborhood or a zip code, and we're really excited about what this pandemic is doing to catalyze conversations in that way, as we hope to continue to make improvements and change.
Thanks, Michael. That's great. Jermaine, are you there? Let's hear about what's going on in your world these days.
Yeah, thank you for having me, and thank you for the kind introduction, Anne. That was really, you made me sound much better than I actually am, so for sure. So I'm Jermaine Freeman, Deputy Chief of Staff here in the Mayor's office, and obviously this has been a trying time for us as we've looked for ways to respond to COVID-19. I've got just a couple of slides that I'll share with you to sort of provide an overview of some of the things that the city of Chattanooga has been working on, and some of the sort of challenges and opportunities that we've observed from a local government perspective, and some of the things that we've tried to respond to. And this is by no means an expansive and all-inclusive list of everything that we do, but it's some of the things that I've been mostly involved in. Beverly, if you could take me to the next slide. Right out of the gate, when there's a huge crisis, people reach out to local government. They expect local government to be responsive, especially in ways that you don't necessarily get from state and federal government. And so what we've wanted to do is to make sure that we were able to provide some resources and to think creatively and to think very nimbly about how to respond to some of the challenges that we've seen in the community. And so from a civic engagement side, one of the things that we immediately realized was, hey, look, our senior citizens make up a substantial amount of our population. And we also know that we've seen data that shows that we have a number of people in our community that have chronic health conditions. People with chronic health conditions and senior citizens, people over the age of 60, these are people who are more likely, statistically, according to the CDC, to have or to experience serious health outcomes or serious health consequences if they become infected with COVID-19. And so one of the things that we wanted to do very early on was to set up a virtual phone bank, which would allow community members to dial in and to actually share information from the CDC, information that's online on the CDC's website, with senior members of our community to let them know about the dangers and the risk associated with COVID-19. We obviously have seen the struggle of small businesses and entrepreneurs in our community. Our community is made up and driven to a large extent by the small business community. And so I, of course, come from a world of economic development, so I am keenly aware of the challenges that small businesses face. And so kudos to our economic development staff for being able to quickly deploy and to put together a $2.5 million plan to provide some immediate emergency assistance to small businesses. I'm proud to say that our economic development team was able, during the first sort of phase of launching that $2.5 million fund, to get $500,000, or actually technically $521,000 worth of very small grants to small businesses like restaurants and barbershops and hair salons and childcare centers. Many of the businesses that were impacted the most by executive orders, because those businesses, were the most susceptible for seeing the spread of COVID-19. And our economic development team was able to get that money out within the span of a month, and that is impressive for city government. And then, our Department of Economic and Community Development has been very good at putting together an emergency housing and utility assistance program that could really be responsive to people who found themselves furloughed or out of work and found that they couldn't pay rent or couldn't pay utilities. And so our team down in our Office of Community Development within our ECD department, they've been very good at trying to get that program off the ground and helping people to meet their rental needs. And then we have, over the past 2 or 3 weeks, launched a series of webinars where we have industry professionals sharing best practices with small business owners about how businesses can reopen safely, because now obviously we're seeing the economy start to reopen again. And we want to make sure that as businesses start to reopen, that they can do so safely and continue to mitigate and prevent the spread of COVID-19. So over the past couple of weeks, we've had webinars that were focused and targeted to retailers, gyms and exercise facilities, childcare centers, hair salons and barbershops. And then most recently, we hosted a webinar for houses of worship and faith-based organizations. And then we also wanted to work closely with the school system and our partners over at the Benwood Foundation and EPB. It became very obvious to us very early on that we really needed to leverage the gig internet that we have and our internet infrastructure to make sure that we could provide more internet access to more students, especially students who might not have internet access or who might not have a quality connection. So I'm proud to say that we were able to work with EPB and the Benwood Foundation and then some of our partners within the school system and Chattanooga 2.0 to actually provide more Wi-Fi connectivity and more internet connectivity for many of our students, K-12 students that are currently living in public housing owned by the Chattanooga Housing Authority, as well as providing and building connection points in different parts of our city where we were seeing sort of a lack of connectivity. And so kudos to the Enterprise Center for really sort of driving that, and kudos to EPB for really being able to deploy the staff and a lot of hardware to actually make that possible. And then Beverly, if you want to just take it to the next slide real fast. And so as we look forward, and I'll wind this up because I know somebody else has got to come behind me. But as we look forward, these are some of the things that we're thinking about from a local government side is, how can we continue to be responsive, and how can we create a more resilient city? And so one of the things that I'm, proud to also acknowledge is that our Department of Transportation, recently announced the Streets as Places, Reimagining the Outdoors, the Sprouts program, which is really going to help restaurants and retailers to continue to practice social distancing while also taking advantage of public spaces so that they can be open and generate revenue, but also try to keep people as safe as possible. So that's kudos to our Department of Transportation for being able to roll out a creative initiative like that pretty quickly. And then, how do we create a more resilient city where we can think about and address the health outcomes that we want in our city? So whether or not that's creating a health and wellness corridor, or what can we do in terms of getting information out to people to see improvements in public health? And then how do we get our small businesses the technical assistance they need so that if there is another spike or another surge or another something else, and let's also not forget that during the middle of this responding to the COVID-19 crisis, we had an EF3 tornado that came through late at night on Easter Sunday. And so how do we help our small businesses to be in a better position to be able to weather those challenges? And then, as I just mentioned with the tornado, how do we create a city that's going to be more resilient to be able to adapt to and adjust to changes in our environment and climate as we see some of these storms come up? And should that continue, how can we sort of prepare our city to sort of think through how to navigate those things? And then we're also thinking pretty keenly about how we preserve the fabric of our neighborhoods and how we sort of better prepare and position our workforce to make them more resilient, to make our citizens more resilient, should there ever be, another slowdown in the economy that really, threatens to put people out of work and jeopardize people's incomes. So that's all I have. So anything else? I guess, Ann, I'll turn it back over to you.
All right. Thanks, Jermaine. Yeah, we're trying to save time for questions toward the end.
Sure.
Greg, let's hear from you about your work and what you've learned and how it's changed since this stuff started a few months ago.
Okay. Well, it's good to be with you, and thank you, Jermaine, for that great introduction. You set the stage for some of the things that I hope to cover very briefly here. Spoken well as a Morehouse man, I can say that. I'm an epidemiologist. I am my focus is in non-communicable diseases, in chronic disease. And when this pandemic opened up, when I first got the word out of China from colleagues there, that indeed the number of people who were being affected by this, and particularly hospitalized, and those unfortunately who were dying, were those with chronic conditions, underlying conditions that had made them more vulnerable for this virus in terms of its progression as a disease. And I thought to myself, well, I was beginning to teach my course in chronic disease epidemiology and to Masters of Public Health students. And I thought, well, there is an interface between chronic disease and infectious disease. And it was my task to show and demonstrate to my students that that was true. So a little bit of an epidemiology lesson here. If you refer to something we call the epidemiologic triad, and the interface between chronic diseases and this particular outbreak is really key in this triad. First of all, epidemiology, yeah, I'm not a skin doctor, so I think most everybody realizes that now. The word epidemiology comes from the root word of demos, meaning population, and epi meaning, essentially affecting the population. And so it's if you will, the study of disease or health events in the population. But the key ingredients to this transmission is the host, and the host is us. And our host resistance is very much dependent on a number of things: our genetics, yes, age perhaps, but most importantly, to our behaviors, our health behaviors, and our risk factors. And therefore, certain risk factors, such as overweight and obesity, physical inactivity, the presence or absence, if you will, of high blood pressure, those kinds of things actually impair the immune response. They actually lower host resistance. And therefore, the other, in this case, the agent now is the SARS-CoV-2 virus. And indeed, that is the agent. And it depends on the virility, the infectious nature of the agent. But the host resistance is really important because a smaller dose may not indeed bring disease necessarily, or may bring a mild disease. As we know already, there are many individuals who have been infected that have shown very few or mild or any symptoms, and others, of course, more severe and more critical kinds of responses. And so this triad is then balanced out with the environment and the context in which this interaction between the host and the agent takes place. And so what one understands, and when we look at the data, particularly in the United States, is we know that 42% of our adults 18 years and older have at least one chronic disease or condition. That's 42%. 60% of our population is overweight or obese. So as I was looking at the data that we had been working with before with the city and also with the county health department, we had had basically identified areas within our city, within our region, where there were higher prevalences of these chronic disease risk factors and chronic diseases, and recognizing perhaps maybe there's a link between the prevalence of those conditions and risk factors and the vulnerability of the populations that have those. And so consequently, I went to a team that I'd worked with before. Charlie Mix is the head of our GIS lab at UTC. And I said to Charlie, I go, Charlie, you know, the work that I was doing before with the city and looking at South Chattanooga and East Chattanooga and looking at the higher prevalences of some of these chronic conditions, perhaps there's a link here. Is it possible that these parts of the city might be more vulnerable for this? And so what I did is we went to Charlie, the magic map maker, and so what we were able to do is to create a series of layered maps of our city. And so this is, so what we did is we took those, and you can see, I'll bring it out a little bit. We had a composite score of COVID-19 risk factors: hypertension, the prevalence of type 2 diabetes, the prevalence of COPD, chronic obstructive pulmonary disease, chronic asthma. And what we found is, this is what our map looked like. And there's zip codes, and you can see neighborhood associations. This is West Chattanooga, if you will. Here's Alton Park. If we look a little bit closer, we see, you know, parts of, here's East Ridge and so forth. And
hey, Greg, we can't see your screen.
You can't see it? Oh.
We can only see the slide with the link on it.
Oh, okay.
So we can't see the map.
You can't see the map. Okay, well, gee, that's too bad. Let me do this. Just a second. How did that happen? I guess what didn't, okay, let's see here, bingo. Okay. Let's see, bookmarks.
Are you sharing just the application or the whole screen?
I'm sharing the whole screen. Can you see that?
I can't see the whole screen. I can only see the application of the PowerPoint.
Oh, really? Okay. Well, let me see. Let me stop that. Sorry, and let me show you this. Can you see that?
Yep, we can see that.
Okay, sorry.
Good to go.
Okay.
Thank you.
Okay, we're good to go. Sorry. I thought it would automatically do that, but it wasn't. Okay, so anyway, you can have access to this. So we have a legend over here, which is and we have and so here's the layers. If we look here at the COVID, so here's the composite score, and we've layered this in different ways, but this is looking at what's happening. And so in terms of again, the prevalence of those risk factors. So these are data that are down at the census tract level that we were able to abstract from the Centers for Disease Control and Prevention. We have other, I don't have enough time to go through all these layers, but the point of the story is this: the high-risk areas, we said, and this was 6 weeks ago that we looked at these things, and we shared this with other organizations within Chattanooga, LifeSpring Community Health. We shared it with SEMPA. We shared it with the hospitals, with Clinica Medicos, and they said, well, gee, these are the areas where we serve. And so, and we shared it with the health department and said, you know, maybe we ought to be doing targeted testing in these areas before we are able to scale up the community testing. And so what you'll find is, and I'll go back, so we've used these maps to basically identify areas where we would most likely see an increase in risk and vulnerability for this infection. Now I'm going to stop sharing that and come back again. And I'm just going to transition back here to this one. And so what I'm going to show here is what was projected today. So we had asked the county health department to actually plot the positive tests. And if we were to superimpose this on the previous maps, you will see that indeed those very hot spots, those highest prevalence, in this case, case number of positive cases or positive tests reside in some of those same areas. And indeed, you know, this was in part in doing the testing in these areas was at least in part due to one of the committees of the task force, the COVID-19 Joint Task Force, led, and that being the community testing subcommittee, that being led by Dr. Schmidt with the Galen Group, and Dr. Colleen Schmidt. And so what happened was in LifeSpring and SEMPA and others and Clinico Medicos were involved in doing community testing. SEMPA and LifeSpring being involved in actually mobile testing to enable the health department to actually see and make these maps. So that's where I'm going to kind of stop. So, but in the second part, I'll come back and we'll talk about this dilemma and what do you do with this kind of information and where do you go in terms of building resiliency, just as Jermaine had set the stage so nicely. And we'll come back to that in the latter part of this program. Thank you.
Greg, while you've already got that ready, why don't we go into that? But I'm going to have to let the panelists know that we took a little longer than we intended so far. So if you could really focus your comments on the second question about let the systems change or catalytic change that needs to happen now.
Okay.
Be as brief as you possibly can.
Okay, so yeah, sure. So in public health and generally we, you know, so epidemiologists are criticized and probably rightly so for always describing the problems. You know, we have a deficiency, we have a need, but on the other hand, so that's what we call kind of a needs assessment, right? On the other hand, there's another way of looking at this glass, which is it's half full with assets and capacities that exist. And so really that's where I think within each of these communities, and I've been blessed to be able to work with neighborhood associations in Alton Park and in Pinewood and East Chattanooga. And it's been wonderful because there's such a great resource there. And young people who are eager to learn, and you know, looking at Michael's presentation, this is where we need to go. And so, so one of the models that I think will work in our community is by reducing the preventable burden of chronic disease. You know, that's really the ultimate goal. And me, myself, as as a chronic disease epidemiologist and public health practitioner, that's exactly. But my hypothesis, and I think it's been borne out in other places, is that we weren't ready as a country for this because the health of our communities and the health of our people is not where it should be in order to really, and so the resilience is that we have the capacity to do that. So in this framework, we look at data-driven decision-making. We look at good epidemiologic data and surveillance data to guide our decision-making. And we share that with our colleagues who are on the front lines as healthcare professionals like Dr. Pickett and her staff. And we share that with our hospitals. And we have, it's a two-way street. They share data with us and we come up with some decision-making that is targeting specific and getting it as specific as possible in local areas. We have to also look at the context in which this takes place, looking at environmental change and environmental supports for healthy eating, for active living, and also for, indeed, adequate housing, employment, all the things that Jermaine and Michael have been talking about, and Michelle. And then this is all done in the context of collaboration and cooperation and coordination, what I call the 3 C's of community health. And the idea there is that we engage individuals where they live, where they work, where they play, and where they learn, and we enhance the ability for people to be equipped to address the chronic disease burden. This is kind of an example of a community assets map. In every community we know, there are places of worship that are assets. There are businesses, and Jermaine talked about the small businesses as being just and probably fundamentally more important than the large ones. Access to parks and open space so that people can be active. Issues around transportation, our youth as the future, education and so forth. So I don't need to unpack this, but you can see where the assets map. Rather than going for a needs, we look at the assets that exist within the community. And so the vision for chronic disease prevention and health promotion for Chattanooga, and if you will permit me, to protection against such things as COVID-19, is it takes, first of all, improving community conditions to really support the health behaviors and promote effective management of chronic disease conditions that will deliver these things. Healthier students in the schools, healthier workers in their businesses, and also businesses and their employers, and a healthy population to the healthcare system. And finally, ultimately, healthier people, and believe it or not, lower healthcare costs, healthcare for all. And with that, that's my picture of resiliency and the capacity that exists to enable people to do this. And some of our students have been in some of the neighborhoods in Orchard Knob and so forth, working with the kids. Community health workers with LifeSpring have been out there with healthy eating and active living, visiting homes. This is what it takes. It takes more than a village, and it takes intersectoral collaboration. And together we can do this.
Thanks.
I'll leave with just one comment. This is a hero, along with David Satcher, who I had the privilege of working under, another CDC director. This was Bill Faggy. He was responsible for leading the team that wiped out smallpox in Africa. Let me assure you, we will survive a crisis that involves funding, political support, popularity, or cyclic trends. Survive the internal crisis if we become provincial, short term, or if we lose our philosophy of social justice. He was a missionary kid, and he was also a well respected and great epidemiologist. So thank you. I'll leave it there.
Thanks, Greg.
You're welcome. Thank you.
I don't know how we improve on that closing, but I would like to hear if Michelle has any reactions to what Greg just had to say about his recommendations.
Well, I actually didn't finish my slides, but I think in reaction, I think it might segue into that, and we don't necessarily have to look at them. But in trying to fit into what Greg has proposed for us as a community, we like to see ourselves in that diagram he just showed as the medical, as a medical provider. And in this pandemic, we feel that everything that we've been doing has actually prepared us to respond. And part of that is being in the community and connecting with the community and being aware of their assets as well as their challenges. And so our community health workers have programs that were in place when this all began. And I will share this with you because I do think that it's helpful. just to see that our community health workers have 3 programs, asthma, and we've been in a partnership with Green and Healthy Homes initiative out of Baltimore, and Green Spaces here, and EPB and TVA, and we were meeting people, we were identifying kids who had a diagnosis of asthma and assessing their home environment in order to improve their air quality in their home environment, and as a way of improving their asthma. And so we had just finished that pilot in the end of 2019, but because of that, we were connected to all of those families and able to use those connections to help to bring a healthy message of how do we take care of families that are now dealing with a pandemic. The other programs, our obesity program, which is called Get Going, which is a 6-month based on motivational interviewing and meeting with families and going into their homes and encouraging them to set goals for healthy living and active living. So we actually were able to deliver raised bed gardens in the middle of the pandemic to our families in order to encourage them that these are ways that are not just dealing with the pandemic, but these are ways that impact their life going forward and after the pandemic. And so there are 45 kids out there who now are growing their own vegetables, and their families were excited to be able to do that. And care coordination continues as we address, try to identify those social determinants. We also, in our practice, are encouraging families to continue to get their kids vaccinated. Our providers are here. We are working with them. We're calling and connecting and trying to connect them so that prevention and healthy living, we are not just reacting to this immediate situation, but that we continue to lay the groundwork for healthy neighborhoods, healthy kids, healthy families, and in terms of helping in the data collection, we also, let's see, am I going? Yep. Well, maybe I'm kind of doing all kinds of things. Sorry. There we go. Our partnership in helping testing, we have been out with SIMPA last week. We were out yesterday, and we're planning to be at La Paz tomorrow, next week in Eastdale, and we're talking about another site around, I think, one of the elementary school on Main Street. I'm blanking on the name right now. But so we want to collaborate and partner with members of our community to be a part of the solution to answering how do we move beyond COVID-19. I think that's the best I can do with my thoughts today.
Thanks, Michelle. Jermaine, your thoughts about fundamental change to government emphasis as you see it from a City Hall perspective?
Yeah, well, so I think that there are some changes that we have to make right out of the gate, just because the COVID-19 impact on our budget from a fiscal perspective is going to result in, I believe, close to an $8.4 million shortfall for us as government. And so that's significant because, obviously sales tax is impacted, hotel motel tax is impacted. And so we as a local government have to figure out ways to do more with less, and to be innovative and to find ways to work even more efficiently with our community partners, because we just don't have the resources that we obviously had sort of gone into the year sort of expecting. But I do think that this is a key moment for local officials, both inside and outside of government, to think about like to earlier points, how can we make some structural changes, some systems changes that can really benefit and impact our communities? Because we've had chronic health conditions in our community for a long time. We've had a number of our residents who are struggling with having the skills needed to take advantage of the new jobs that are being created in our community. Workforce challenges have been an issue for a while, and so these are questions that we continue to wrestle with, and this is the time, and this is sort of the moment for us to do what we can, given the fiscal constraints that we have, to think about how to create some of those systems changes that everyone is talking about. We want, I think, at the end of this, knock on wood, at some point we are going to get to the end of this. But the question that drives us in city government is, what do we want the city to look like when we get to the other side of this? And what do we want our city to look like as we go through, as we sort of go through this process? And so those are the questions that we're wrestling with. And I think that there are going to be some opportunities for systems change, and there are going to be some opportunities to sort of enhance, some initiatives that maybe people have been working on throughout in the community that haven't gained a lot of traction up until now. I think the thing about these situations is that this really gives people and organizations an opportunity to shine and to try new things. And so there's an opportunity for us to do some new to do some new things that can create lasting impacts for the community and for our residents. Thank you.
Jermaine. Michael, you mentioned catalytic systems level change. So what does that look like in your world, real quick?
You weren't supposed to be listening. I think it's everything Jermaine was just getting at. In the education world, we just convened a panel of national experts, and Dr. Gary Steger was one of them. He's a prolific author in K-12 ed, and he used a line that I thought really captured where we're at, and it's true whether we're in a virtual learning environment or in person. First, he asked the question. He said that the pandemic really forces us to wrestle with this question of, why do we go to school in the first place? And do we really take advantage of face-to-face interactions the way that we should? And as I've thought about that, I think that really usurps education, and is something that we're seeing industry ask the same question. We're seeing healthcare ask the same question with the proliferation of telemedicine. So I think it's really, as I think about a catalytic force for systems change, I think that's a singular instance where we see really starting to ask questions around, how are we capitalizing on face-to-face interactions when we have them to begin with, and are they always necessary? I think it also, the pandemic in education, but again, sort of bigger than education, has surfaced something that I think is a huge compliment to Chattanooga. Jermaine mentioned this in his opening remarks, that you can't address the first question I just proposed without talking about equitable access. I mean, the two are intrinsically woven together, and it's just not possible to discuss the two in isolation. So looking at what Chattanooga did, and I would say that both Hamilton County Schools as a great model, what Enterprise Center, EPB, City of Chattanooga did in terms of just quickly responding to provide access, to address some basic needs. In education, we talk a lot about Maslow before Bloom's. If a child is hungry, how can they learn? The school system rapidly mobilized their networks and their energy to provide a lot of the things that at some point at the end of this pandemic, looking for the light at the end of the tunnel, we may start asking some questions around, our school system is increasingly shining as a beacon of what's possible, but are we asking schools to do too much? Are we asking schools to address needs that other community organizations should be addressing, and free schools up to really focus on teaching and learning. So as I think about it as a catalytic force, it really drives a lot of questions. And as I think the third sort of leg of that stool that I'm very interested in the K-12 space, and I know the Public Ed Foundation is particularly focused here, and many of our partners have already started thinking about, is as we start to sort of get our feet on the ground around how do we address things like access, like basic needs, and food insecurity, some of the things that we've already had a conversation about on this call. From a education standpoint, it really frees us to start to do some research and do some pioneering work in terms of innovating how we think about and how we go about implementing hybrid learning models. You know, is it a blend of distance learning and in-person learning? And if we do so, and as distance learning becomes an increasingly common component of, you know, K-12, K-16 education, it really forces us to rethink what that learning looks like. You know, what are instructional strategies? Gary Steger's line at the end of our call, he said, you know, there's a real tension now between content acquisition and learning as a result of rich experiences. And as I think about, from a workforce development standpoint, education's role in our community, that's a piece that I know the school system is wrestling with, is increasingly starting to think about and frame as we think about preparing students to be successful in a dynamic workforce and meet needs that we just don't know exist yet. It really makes us rethink sort of the learning process, as opposed to just pouring out information, increasingly putting students in situations where they learn as a consequence of rich experiences, the way many of us have learned as adults.
Thanks, Michael. And thanks to all the panelists. I mean, it's been a rich discussion, but we really just touched on, not able to go very deep on the range of issues that you're all confronting every day, and coming up with some pretty amazing approaches to what we're all going to be facing in the future. And, you know, I'm happy you're in my city and you're doing the work you're doing. Keep it up. Let's see if the rest of us can't help better support your work and listen to the lessons that you're learning. We have several questions. Eric, shall I turn it over to you to figure out how you want the panelists to respond to those questions?
Sure. We have about 5 on the Q&A and chat box, and I think I'll just handpick a few in the remaining time that we have left and just read them. I think a lot are aimed at you, Jermaine, but I'm going to only take a couple, and not to put you on the spot, my friend. We have one from our friend in Asheville, Steph Munsendahl, who I think you could probably put these two together. I'm interested in hearing how Chattanooga, the community, government, private, nonprofit included, might be working on ways to adjust how public streets, sidewalks, parking, parks, etc., transit are being used to support a safe economic recovery.
All right, that one's for me. Is that right?
I think so.
Okay. All right. Good deal. So a lot of that work is being driven by our Department of Transportation. But obviously what the balance that we have right now as a city is, how do we safely use public spaces to sort of let our small businesses do their thing and safely reopen the economy? Hence, you know, the initiative that I described earlier that CDOT is doing with retailers and restaurants, and the usage of sidewalks, the Sprouts program. But then also, like, we also want to make sure that we aren't, you know, contributing to things or events or the uses of the public realm that would put people's health at risk. And so the dilemma that I think governments face is, yeah, we want to better utilize like the sidewalks and the streets, but we also, you know, we're also not ready to have a festival in a park, right? Because like obviously you're not going to have people social distancing, and so you know, just sort of striking that balance is really the tough thing for us right now. But you know, I think we'll get there. I think that disease is going to push us to think about things in new ways. And, we will also defer to our local health department as well as the governor's office for direction and guidance on the actions that they sort of see as being as a state is being ready for in our local county. But yeah, I think that there are some obviously some innovative uses of public space. Again, just sort of going back to the things that our Department of Transportation is doing that are really sort of interesting and cool. And I hope that we can see more cool stuff. So
next up, we have a fantastic question from our friend James McKissick at Artsfield. I'm just going to lob this one out there, see if who wants to take it on. This is a good one. Do you think that COVID will result in more equitable programming and public policy? For example, resources being focused freely on those disproportionately affected, or do you think we'll continue down the path of race-blind action and efforts?
Is that one for me?
It's for anybody who wants to take it. I have a response too, but go ahead, Jermaine.
So, I think that we can always think about ways to be more equitable. I think that, I think that, equity is something that we all should continue to strive to do. And so, yes, I definitely think that responding to and making sure that we are adequately and effectively providing resources for all the members of our community. We do need to be thinking about that through an equity lens. And so, to James's question, yes, my hope certainly is that we do sort of start to think more and more about equity in terms of the way we do programming and the way we do public policy, because oftentimes it's unfortunately it is very easy to not think about equity when we design programming and design public policies, and so we do need to be thinking about those things. And so I know on the business side, for example, we are constantly trying to think of ways to make sure that more minority-owned businesses are represented in the resources that we make available, that more small businesses that are owned by women are represented in the resources that we make available. And so yes, I absolutely think that this should prompt all of us to think more about equity. And I think we're doing a disservice to the community if we're not thinking about equity in all of our programming and policies.
I might comment too. I agree wholeheartedly with what Jermaine has just said. In the public health sector and the healthcare sector, I can tell you that it can't stay the same. We know and have known that there are serious health disparities that exist that are along socioeconomic lines, yes, racial and ethnic lines, yes. But the solution is, I think, Jermaine sort of, I think, captured it early on in his presentation and what they're doing and what they've done during this outbreak. Things cannot remain the same. It's unacceptable. And I think that public health sphere, one of the things that from a national point of view, our public health system was not ready for this. Our system was not ready for this. And we're going to have to make some serious changes. I think an organization that has, I think, a good handle on this in terms of their thinking, in terms of their programming, and in terms of where they're putting their money is the Robert Wood Johnson Foundation. And with their emphasis on a culture of health and the importance of equity associated with that, but also too, it has to do with healthy communities and intersectoral collaboration and systems thinking that's going to pull us into a different place and into a more positive approach than what we've been doing and what we're finding ourselves struggling with right now. So that's I'm not a Jeremiah, I'm not a prophet, but on the other hand, I think there's going to be serious change, and that's good.
Thank you guys for that. So the next question is for you, Jermaine. This was an earlier one. I'd love to hear more about Jermaine's thoughts on enhancing the fabric of our neighborhoods. Elaborate on what that means.
Yeah, so I think that one of the things that we think about here is as we start to move forward, and so obviously we created like a stabilization fund for small businesses to provide emergency assistance to small businesses. But as we start to think about a longer term recovery, I think what we need to start doing is to think about the neighborhoods that those businesses are in, and what are some investments that we can potentially make, or what are some things that we can do to enhance and protect our neighborhoods. You know, we should think about the spaces that we want to protect and the neighborhoods that we want to grow, and how do we make investments in those. And you know, so like for example, you know, if you look in our capital budget this year that we proposed for fiscal year 21, we have things like the Alton Park connector, which would, you know, provide like a great, you know, shared use path in the Alton Park community. And so things like that, or the Midtown pathway, which is also in our budget this year. Things like that you know can be things that lots of people can enjoy, and that can sort of enhance the public realm and help you know, help our neighborhoods is going to be really key. You know, because again, we want to continue to help our small businesses, and we will continue to help our small businesses, but we also have to think, you know, longer term, and so like what comes after all of the assistance for the small businesses. And so looking at ways that we can focus on the neighborhoods where we really want to, you know, sort of protect and save the fabric of those neighborhoods is going to be really key.
Thanks, Jermaine. You're a popular guy. I think this one's headed towards you as well.
Okay.
Have there been any thoughts to transforming Market Street and or Broad Street to become pedestrian only? If so, wouldn't this benefit our city in the long run?
I am not familiar with any conversations about transforming Market and or Broad to pedestrian only. If that conversation is happening, I have not been invited to participate in that conversation. But you know, I definitely think though that anytime that we can create, you know, more spaces for people to get around our city safer and to enjoy our city without a car, I think those are typically good things. And so, you know, you look at you know, the investments that our city has made over a number of years, whether it was with the renovation of the Walnut Street Bridge or the Riverwalk or bike lanes. Like we've done a lot of stuff to create, you know, multimodal sort of transportation, and I think that's great. I think, you know, to Greg's points, if we want to see better health outcomes, we've got to get people out of cars. We've got to get people on bicycles. We've got to get people walking, and I think it'll create, you know, a better sort of civic life for us all, and we'll be healthier for it. So I have not heard of Market Street or Broad Street becoming pedestrian only, but I typically am a big fan of things that sort of encourage pedestrian use.
Oh, amen that. And yeah, I mean, we've been working with the city transportation department and doing some assessments, looking at those neighborhoods that I had shared with you in terms of some of the mapping that we've done in preparation and in support of for example, the Alton Park you know, rail trail conversion. And the hope is that we become, as a community, and particularly the business community, get behind these efforts and support the city with resources and support financially to be able to build more infrastructure that supports pedestrian and biking. And also too, don't forget our public transportation system, and we want to enhance that. We know that people who walk to catch the bus actually are more likely to increase their activity to a healthful level, as opposed to those who just drive into town in an automobile. So let me know, Jermaine, how we can help.
Will do. Thank you.
We're coming close to the end of our time. Anne, do you want to make some closing remarks? Do you want a couple more questions?
Well, I will just mention, because I find in this time of sort of enforced being at home, and that being both, my workplace and my place of recreation and thought and sleep and everything else, really looking for new thought leaders in these times who are thinking in fresh and interesting and hopeful ways about cities. And there was a whole section in this past Sunday's New York Times about what cities need. And I would urge everybody, if you haven't seen it, to try to get hold of it. It's an incredible range of articles, and one of the focal points is public education. But there's a piece by the incoming head of the School of Architecture at MIT. I probably won't pronounce his name right, but it's Nicholas Monchot. And I noticed today the closing, his closing comment, and it really fits with some of the comments of our panelists today as they talk in their multidisciplinary way, particularly about things like collaboration and cooperation across the board. And that closing says that, for in the end, urban resilience is not purely a physical, social, or economic goal. It is one like well-made streets and sidewalks that should connect every part of public life. And we really had in the wisdom of these panelists, and of the questions too, every part of public life. And we've really got to think more expansively and more holistically about what that means as we take our cities forward, I think. And thanks for doing this, everybody, and all the participants, and Eric, you all, for giving us this chance tonight.
Thank you.
Yes, I want to echo that. Jermaine, Michael, Michelle, Greg, Anne, thank you. This has been, although very odd to be distant, it's been a wonderful evening. I've enjoyed this time with you, and I hope that everybody that attended here did too. And so I want to play something for you. Hopefully you'll hear this, because of this being so distant and odd. You can't hear applause, but maybe you'll hear this. I think hopefully it'll play. Great job, and thank you guys so much. Thank you for what you do for Chattanooga.
Thank you, Eric. Thank you, Anne.
Thank you. Thank you so much.
Thanks,
Thanks.
everybody.
Thanks, guys, for tuning in.
Thank you.